Subscribe now for easy-to-understand health tips. Dr. Madam explains the 7 common causes of constipation. Why does it happen? Find out. Some people are rushing off to work, grabbing a quick breakfast, and then spending the whole day working at a desk. People are forgetting to drink water. Have you ever wondered why you still get constipated even though you're eating properly? You're not alone. Around 1 in 4 people worldwide experience constipation at some point in their lives. The good news is, if you can understand why it happens, it's easy to manage. There are practical ways to solve this. In today's video, we'll learn why constipation happens and what common factors are responsible for it. You'll find out how eating low-fiber foods and not drinking enough water can make your stool hard and dry, and why sitting all day or not exercising slows down your bowel movements. How mental stress, changes in routine, and even certain medications can worsen constipation. What happens when you repeatedly ignore the natural urge to have a bowel movement, and when constipation might actually be a sign of another underlying health issue. By the end of the video, you'll clearly understand the real cause of your constipation and how to naturally eliminate this problem from the root. The information and script for this video were written and reviewed by Dr. Shreyasi Chatterjee, MRCP UK, medicine specialist and expert in diabetes and hormones. The information has been sourced from Mayo Clinic, Cleveland Clinic, NIDDK, and NHS UK. Before starting the video, please subscribe to the channel to get more easy-to-understand health explanations that will truly benefit you. Now let's find out the 7 main causes of constipation and how each cause gradually affects the functioning of your intestine. Let's start with the most common cause: not having enough fiber in your diet. Fiber is the intestine's natural broom. It absorbs water, adds bulk to the stool, and keeps it soft so that it passes easily. An adult needs about 25 grams of fiber every day, which can be easily obtained from fruits, vegetables, lentils, nuts, seeds, and whole grain foods. But when we skip these and eat white bread, refined flour products, fast food, or processed foods, that essential fiber is lost from our diet. As a result, the stool becomes hard, dry, and difficult to pass. So remember, if your plate is colorful with fruits and vegetables, your gut will thank you. 2. Not drinking enough water. The second major reason is drinking less water. When the body lacks water, the colon absorbs extra water. As a result, the stool becomes even harder and denser. Water keeps the stool soft and helps it move easily through the intestines. If you don't drink 8 to 10 glasses of water a day, your intestines have to work extra hard. So, keep a bottle with you and drink water little by little throughout the day. Remember, fiber doesn't work without water. In fact, it can even increase constipation. Sitting all day and lack of exercise, most people don't even realize it. Your intestines need movement just like your muscles do. When you sit all day, your digestion slows down. Regular exercise stimulates the colon and keeps your abdominal muscles strong, which is very important for bowel movements. People who walk, do yoga, or engage in light exercise rarely suffer from constipation. But those who sit at a desk all day disrupt the natural rhythm of their intestines. So, walk for at least 20 to 30 minutes every day. Your intestines will become much more active. The 4th reason is the side effects of certain medications. Some medicines cause constipation. The most common ones are opioid painkillers, such as codeine or morphine, and iron supplements, which are often prescribed for anemia. Antidepressants, antacids that contain aluminum or calcium, calcium channel blockers, anticonvulsants, and diuretics. Studies have shown that about 90% of cancer patients who take painkillers long-term experience constipation. Therefore, if you notice any changes in your bowel habits before starting or stopping any medication, be sure to consult your doctor. 5th, ignoring the urge to have a bowel movement. This is seen in many people. When you repeatedly ignore the urge to pass stool, whether it's at the office, while traveling, or due to public toilets, the colon absorbs more water from the stool. As a result, the stool becomes even harder. Gradually, the natural rhythm of the intestines is disrupted and the urge to have a bowel movement decreases. Many people also avoid going to the toilet out of fear of pain from anal fissures or piles. As a result, the problem worsens even more. So, listen to your body. Go to the toilet as soon as you feel the urge. Changes in routine and mental stress. When there is a change in your daily routine, constipation can often appear suddenly. Travel, pregnancy, aging, or irregular sleep, these disrupt the body's natural schedule. During pregnancy, hormonal changes and pressure from the uterus slow down the movement of the intestines. And as you age, the efficiency of the intestines also slows down a bit. But here, mental stress also plays a major role. Your brain and intestines are connected to each other. During times of worry, anxiety, or mental stress, the movement of the intestines slows down. This is called the gut-brain connection. Your mental state directly affects your digestion. That's why when your mind is well, your stomach feels good too. However, sometimes, after ruling out all physical illnesses, long-term constipation can be a sign of a deeper physical problem. For example, IBS, irritable bowel syndrome, diabetes, hypothyroidism, Parkinson's disease, or multiple sclerosis. These diseases reduce the function of the intestinal muscles and nerves. In cases of spinal cord injury or pelvic floor dysfunction, bowel control also decreases. Even if there is an intestinal obstruction or tumor, bowel movements become slow. So, if constipation lasts for more than 3 weeks and does not improve even after adjusting your diet and routine, you must consult a doctor. The bottom line is that constipation is not just a stomach problem, it reflects your entire lifestyle. What you eat, how much water you drink, how much you move, and how much stress you take, all of these are important. So, start making small changes. Eat more fiber-rich foods, drink more water, walk a little every day, and never ignore your body's natural urges. Because a healthy gut means a healthy life. This video script was written and reviewed by Dr. Shreyasi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone expert. The information has been taken from Mayo Clinic, Cleveland Clinic, NHS UK, and NIDDK. If you find this video helpful, please subscribe to the channel and share the video, because good health begins with a good heart.